Hello, thank you for supporting this channel. Welcome everyone. Today we are going to talk about 5 dangerous factors about your dog's cough, and with this information you can help her. So let's go to the content.
Number 1. Infections. Respiratory infections in dogs can be caused by various infectious agents such as bacteria, viruses and fungi. Bronchitis, for example, is an inflammation of the bronchi that can be caused by a bacterial or viral infection. Pneumonia, another common respiratory infection in dogs, can be caused by different infectious agents, including bacteria, viruses, fungi and parasites. Tracheitis, an inflammation of the windpipe, can also be caused by bacterial or viral infections, as well as allergies and irritants. These infections can affect the dog's breathing and cause a cough, which is usually dry and persistent. In addition to coughing, dogs with respiratory infections may also have other symptoms, such as fever, sneezing, nasal discharge, lack of appetite, and lethargy. Treatment for respiratory infections in dogs usually involves the use of antibiotics or antivirals, depending on the cause of the infection. In more severe cases, it may be necessary to hospitalize the dog to administer fluids, oxygen and other supportive treatments. Therefore, if you notice that your dog is coughing and showing other symptoms, it is important to take him to a veterinarian as soon as possible to obtain an accurate diagnosis and start the appropriate treatment. Number 2. Allergies. Dog allergies are quite common and can be triggered by many different factors such as pollen, dust mites, dust, chemicals and food. When a dog is exposed to an allergic substance, the immune system can overreact, releasing histamine and other inflammatory mediators that can irritate the airways. Cough in dogs with allergies can be dry, persistent and accompanied by other symptoms such as sneezing, itching, watery eyes and a runny nose. It's important to remember that not all dogs with allergies have respiratory symptoms, but if your dog has a chronic cough that gets worse at certain times of the year or in certain environments, an allergy could be the cause. The diagnosis of allergies in dogs can be made through skin or blood tests that detect the presence of specific antibodies for allergic substances. Treatment may involve the use of antihistamine medications, corticosteroids or immunotherapy, which consists of exposing the dog to progressively larger doses of the allergic substance to desensitize the immune system. In addition to drug treatment, it is important to control the environment in which the dog lives, reducing exposure to allergic substances and keeping the environment clean and free of dust and other irritants. Therefore, if your dog has a cough and other symptoms of allergies, it is important to take him to a veterinarian to obtain an accurate diagnosis and start the appropriate treatment. Number 3. Heart diseases. Dogs with heart disease may have a cough as one of the main symptoms. This is because heart disease can affect blood circulation in the lungs, leading to fluid buildup and increased pressure in the pulmonary arteries. This buildup of fluid is known as pulmonary edema and can cause the dog to have difficulty breathing and start coughing. Heart disease in dogs can have several causes, such as valve disease, cardiomyopathy, coronary artery disease, among others. Symptoms can vary depending on the severity of the illness, but in addition to coughing, dogs with heart disease can also experience shortness of breath, tiredness, loss of appetite, weight loss and fainting. Diagnosis of heart disease in dogs may involve tests such as radiography, echocardiogram, electrocardiogram and blood analysis. Treatment may include the use of medications such as diuretics, angiotensin-converting enzyme inhibitors, and beta blockers, as well as changes in the dog's diet and lifestyle. Therefore, if your dog has a persistent cough, especially if it is accompanied by other symptoms, it is important to take him to a veterinarian to carry out a complete evaluation and rule out possible heart disease or other health conditions. Early diagnosis and treatment can help improve your dog's quality of life and prevent serious complications. Number 4. Tracheobronchitis. Canine infectious tracheobronchitis, also known as kennel cough, is a highly contagious respiratory infection in dogs. This disease is caused by a combination of viruses and bacteria, including canine parainfluenza virus, canine adenovirus type 2, and Bordetella bronchoseptica bacteria. Symptoms of kennel cough include a dry, persistent cough, similar to a gurgling sound, which may be made worse by exercise or excitement. Some dogs may also have a fever, loss of appetite, and a runny nose. Symptoms usually appear about 2 to 14 days after exposure to the virus. Kennel cough is highly contagious and can be transmitted from dog to dog through direct or indirect contact with infected objects such as food bowls, toys and collars. It is more common in dogs that live in shelters, kennels and other places with a large concentration of dogs. Treatment for kennel cough can include antibiotics, anti-inflammatories, and cough control medications. Disease prevention can be achieved through vaccination against canine parainfluenza, canine adenovirus type 2 and Bordetella bronchoseptica. Vaccination is especially important for dogs that are frequently exposed to other dogs, such as those that attend dog daycares, shelters, and dog shows. Number 5. Breathing obstructions in dogs can be caused by foreign bodies, such as grass, seeds, pieces of wood or bones, which can get stuck in the dog's throat, upper or lower airways, or lungs. These obstructions can lead to coughing, choking, difficulty breathing, excessive salivation, vomiting, and in severe cases, even death. The severity of symptoms varies depending on the size, location, and type of foreign object causing the blockage. Some objects can be expelled naturally by the dog, but others may require immediate veterinary intervention, such as surgical removal. Dogs that have access to areas with small objects, such as lawns, parks or rural areas, are more likely to have respiratory obstructions. Dogs that like to chew on objects are also at greater risk. If you believe that your dog may have swallowed a foreign body or is suffering from a respiratory obstruction, it is important to take him to the veterinarian immediately. The veterinarian can perform an evaluation and tests to determine the cause of the problem and act quickly to remove the object or treat the obstruction to prevent more serious complications. Preventing your dog's access to small objects and being aware of their chewing behaviors can help prevent airway obstructions.
Thank you for getting here. I hope I have helped in some way. If you liked it, like it and subscribe to the channel, so you will be the first to have new important information about dogs. I hope you are well and have a great day.